Welcome to the show today, Dr. Wu. It's a pleasure to have you back again.
Thank you very much, June, for inviting me.
You're welcome. And Kenya Hooper from Brunswick Novant Medical Center. It's a pleasure to meet you.
It's a pleasure to be here.
Thank you. Well, let's start by learning a little bit about both of you, your educational background and your experience. We'll start with you, Dr. Wu.
Again, my name is Edward Wu. I'm an obstetrician gynecologist with Brunswick Women's Center. I just recently relocated to Brunswick County a little over a year ago. I am a Canadian. I was born and raised in Canada and attended University of Alberta, where I did my undergraduate and my medical school training. Then I came down to the United States and did my residency training in Akron, Ohio. And I have been a practicing obstetrician gynecologist for approximately 16 years. And I am board certified.
And what is your role with Novant?
Well, again, I am a member of Brunswick Women's Center, which is a practice within Novant Medical Group. So, and in that group, we have a total of 4 physicians and 1 nurse practitioner. My partners are Dr. Tracy McCarthy, Dr. Lee Toller, and Dr. Lee Hsu, and our nurse practitioner is Sarah Brown.
Wow, great. And you practice at Brunswick Novant Medical Center, is that correct?
Yes, we do. And in fact, that is the only facility that we are presently practicing at.
So you deliver all those little babies and
Yes, we do.
all that cute stuff.
Yeah, we deliver the babies and do our surgery at the hospital.
Great, great. Now, Kenya, tell me about your education and your training. Where did you go to school?
I went to surgical technology school at Millamont College in Wilmington. I have an Associates of Applied Science degree in surgical technology. I also have a Bachelor's of Science degree. I've been in the field for 9 years as a surgical technologist, but prior to that, I worked as a patient care technician in the surgical ICU. So I've been in the medical field for quite some time.
For quite some time. You have
Yeah.
a lot of great experience. Well, good. Well, it's a pleasure to have both of you here today. And I know today's topic is about the Da Vinci robotic surgical system that we've recently acquired at Brunswick Novant Medical Center. So, Dr. Wu, can you tell our viewers exactly what the Da Vinci surgical system is?
The Da Vinci system is a system that extends our capability of doing minimally invasive surgery. It allows us to mimic the movements of our hands, whereas with regular laparoscopy, the instruments are not jointed. So there's less trauma to the patient. The visualization is also better because it's a 3D camera. And the way it occurs is that the machine is what we refer to as being docked onto the patient after we put in the laparoscopic ports. And then we scrub out and we go to a console. And that console allows us to manipulate the instruments and see what we're doing where we're at the patient's bedside. So we're not actually at the patient doing the surgery, but we're at a console doing it with the robot.
You mentioned the term minimally invasive surgery. What
Yes.
does that really mean?
Well, minimally invasive just means that the incisions we use are very small. So the whole goal of the surgery is to accelerate the recovery for the patient and to minimize pain postoperatively.
And those are good things to do because I
Yes.
guess you get your patients out much quicker. And
Well,
they
goal,
just recover much quicker.
yeah, and the goal not only is to get the patients out of the hospital and recuperating faster, but also get them back to their normal lives faster and not be laid off from work from 4 to 6 weeks or longer.
Right, yeah. Well, what types of procedures does Brunswick Novant Medical Center offer on the Da Vinci?
Well, at this point in time, myself, I am doing total laparoscopic hysterectomies with or without removal of the tubes and ovaries. And Dr. Rock McCarthy, who is a urologist with privileges at the hospital, is performing radical prostatectomies
Okay. So those are the two
at this point in time.
procedures.
Yes.
Well, you talked a little bit about a more rapid recovery, but what are some of the other benefits to using Da Vinci as opposed to traditional methods of surgery?
Well, traditional methods being open, total abdominal, again, is with a larger incision. So not only is there a faster recovery, but with the Da Vinci over regular laparoscopic surgery, there's less pain for the patient because the ports that are inserted into the patient, where they're inserted into the patient's body, it acts as a fulcrum. So it rotates around that point and it isn't moved around. Whereas with regular laparoscopy, we often have to move the ports back and forth, side to side. And that does traumatize the tissue and cause more pain after surgery.
Now, you talked a little bit about the way the Da Vinci system works. I wonder if you could elaborate a little bit more because you said that it's docked on the patient. Let's talk a little bit about what that means and then where you are during that procedure. And then we'll talk to Kenya and about where she fits into this.
Well, the machine has one arm specifically for manipulation of the camera. So we can manipulate the camera back and forth and also adjust the focusing. And then it has 3 robotic arms, and each of those arms is attached to a surgical instrument. And at this time, I'm only using 2. I have no use for the third, but the third is available, and I believe Dr. Rock McCarthy uses all 3 robotic arms. So once we place the robotic ports into the patient, we bring the machine, the robot, up to the operating table. And then we attach the arms to these ports. And then we put the instruments through the port, and they're controlled by the robot. And when I'm at the console, I look into a field of vision that is 3D, and the console also senses when I'm actually looking in. So as soon as I take my head away, the control of the robot is frozen, so nothing can be done.
Nothing.
And then I use 2 fingers. I use my thumb and my index finger, and they insert into 2 controls, hand controls. And the hand controls mimic the movements of my wrist exactly. So if I go forward, the robot arm goes forward. If I go back, it comes back. And if I pinch or open my fingers, the robot does the same thing. And then I also have pedals that control any use of electrical energy for cautery, whether it be what we call bipolar cautery or also monopolar cautery.
Wow, that's really cool.
It is. And this was originally technology that was developed for use in the armed forces. I believe it was used in a way to try and save soldiers' lives that were injured. And I don't know if they do it remotely or have ever done it remotely, but the cables that connect the robot to the console are there. So again, I'm at the patient's bedside. I'm still in the same operating room, but I'm not actually at the patient's bedside doing the surgery.
Wow, that is the coolest thing, but it reminds me of a video game.
It is,
Yeah.
and in fact, using video games and the hand-eye coordination often comes into play when we do regular laparoscopic surgery, as well as using the Da Vinci robotic system.
Well, that's really interesting. Well, I'm going to shift the focus a little bit to Kenya, and I want to talk to her about your role with the Da Vinci and how do you work along with the surgeons? What would your role be?
I'm like an extension of the surgeon. When he is at his console, I'm at the patient's bedside, and I'm switching out the instruments on the robot for him, and I'm making sure that the patient is safe at all times. So, and I'm troubleshooting, making sure that everything is running smoothly.
Now, I assume in addition to the training that you had at Miller Mott in your surgical technology program, you've also had education and training with the robotic services. Is that correct?
Yes.
And was that training performed here or at another facility, or did you have to go away for that?
I've gone away to several different places for training. I've gone down to Celebrations, Florida, and worked with one of the robotic surgeons down there who does like 5 or 6 robotic cases a day.
Wow.
And so I got to spend 2 or 3 days down in Celebrations, Florida, working with him.
That's great. So not every technologist, not every surgical technologist has the skill to perform the robotic tasks. That's usually an additional training. Is
Yes.
that correct?
Yes,
Well, that's wonderful. You seem like you enjoy it.
I love it.
Well, good. Now, how long have you been a surgical tech working with Da Vinci?
5 years.
5 years. That's quite a long time.
Yes.
If the patient is preparing for surgery on the Da Vinci, what would you tell them to expect? And either one of you can answer that, or both.
Ladies first. I'll let you go
Go
first,
ahead,
Karen.
Kenya. Tell us how might you prepare the patient? What might you say to the patient? Do you tell them what it looks like, and do you tell them what they might experience or feel, or?
Would probably explain to them what it's going to look like, because there's 3 different parts to this machine, and so when you come into it, it's like, wow. And so I would probably explain to them what it's going to look like and positioning, what type of position they'll be in, because they are in a very steep Trendelenburg position, and so I would probably explain that to them. And
It's likely they may be already asleep by the time they get in there and won't remember it.
Right,
just
but
in
they'll
case
feel the effects from that, post-surgical,
Right.
from being in that position. So,
And I'm sure they appreciate that, because surgery is always traumatic, whether it's Da Vinci or if it's the normal route.
Right.
It's always a traumatic experience. So, do you have anything to add to that, Dr. Wu?
I think the confusion with when patients hear robotic surgery, they think a robot is doing the surgery, that the surgeon has no actual interplay with the robot.
Right.
But the robot is only an extension of our movements and our thinking and our skills. The robot does nothing on its own. It's all controlled by us at the console. So when patients hear that, and when they first come to us or hear the term robotic, they think that they just are hooked up to this machine and the machine does the surgery and we're just there to troubleshoot or if something untoward happens. But the correct thinking is that it's actually extending our capabilities and allowing us to do more through those small incisions than may be done with regular laparoscopy.
You said small incisions. Typically, what would be the size of an incision?
Well, the incisions for the camera and for what we call the assistance port are usually 10 to 11 millimeters. So that's less than half an inch.
Oh,
And
okay,
for
that's
the instrument,
small.
it is. And for the robotic ports, it's 8 millimeters. So that's a third of an inch. So the incisions are very small compared to a standard laparotomy, which is from the belly button down, or what we call fan and steel or bikini line incision. Those incisions can be 6 to 8 inches in size.
Well, that's very, very small. I really didn't realize it was that small.
They are. Yeah.
Wow. Now, you talked a little bit about recovery time, and so I just wanted to clarify. You would expect the recovery time to be somewhat shorter?
Yes. Compared to an open procedure, the hospitalization is typically anywhere from 2 to 4 days.
I see.
And a recovery period is typically 4 to 6 weeks before a patient can return to work.
Wow.
With a laparoscopic procedure, usually a hospitalization is 1 or 2 days, and patients can be back within 4 weeks. But with the Da Vinci, those times are even shorter. So most patients can go home the next day within 24 hours or shortly after 24 hours. And I've had patients go back to work as quickly as 2 weeks after surgery.
Wow. Well, that is great information. I can't thank you both enough for being here. Before we close, is there anything else that you would like to add today?
Well, I think this is quite a credit to the hospital to be able to bring this technology to Brunswick County. This is a very expensive piece of technology. It's over $1 million. So it is a significant investment, and I was impressed that the Novant was investing in this technology to bring to the the people and patients of Brunswick County.
Yeah, that's wonderful. Well, again, thank you so much for being here today, and I look forward to seeing you both real soon.
Thank you
Thank
very
you.
much.
You're welcome.